I'm Dr. Lawrence Antonucci, and I'm President and CEO of Lee Health. We are a public, not-for-profit hospital in Southwest Florida. Our mission is to be a trusted partner to empower healthier lives through care and compassion, and we do that in many ways. In addition to being the dominant inpatient provider, we have extensive outpatient outreach in our community. Because of our position here, we recognize that we own the health of this community. And as a result, if we don't do the outreach, those patients will wind up in our EDs sicker than they really should be. So we do everything we can to operate these clinics and do outreach in this area. Unlike most businesses, we can't raise our prices. We're heavily dependent on federal funding, whether it's the Medicare or the Medicaid program. 75% of our business comes from those programs. So as a result, our top line is frozen, but our expenses continue to go up, especially our labor expenses. Last year, we spent $170 million on contract labor. And just a few years ago, we were spending $7 million. If you look at our staffing challenges that started before the pandemic even was here in 2020, and then you recognize that starting out with a staffing shortage, getting into the pandemic where we've seen significant burnout for our providers, our nursing turnover across the country is high. And as a result, we're having to rely on shift incentives, extra bonuses, contract labor. All these things that we just never experienced in the past are driving costs up dramatically. And the sad part is that we don't really see an end to this, and we don't see a short or even an intermediate term solution. And I think that's what's most worrisome. We have to look at realistic reimbursement, and covering the cost of care, I think, is basic common sense when you look at the Medicare and the Medicaid programs. I think parity for telehealth services, I think things like that, increased funding for behavioral health. We know that probably 1 out of 5 patients in our emergency department are there for a behavioral health challenge. And we simply don't have the services in the community because the reimbursement is terrible. And the people who really need the care just can't get it. When you realize what happened to health systems across the country when we were faced with, first of all, having to shut down a lot of services for a short period of time, spending more money on personal protective equipment, and all the things that went with that, extra shifts, et cetera, we were able to withstand that because we were financially strong. But there's only so long you can do that.